So today's, you can say, a marathon class going on. I will try to complete it within an hour, but if I fails that, I will complete rest of the part in the next week, because the next week the practical topic is also stomach cancer. Okay. So before starting the class, I have few questions for you, and this is related to the Neoplasia chapter, and that is important for today's class. Okay, you are supposed to know the answers of these questions. So what is the answer of this question? MCQ question. Both A and B. Everybody is okay with this answer, or somebody is having some other answers? Everybody? How many of you are agreeing with this answer? Okay, majority are agreeing with this. Okay. And how many of you are disagreeing with this? Nobody? Okay. So you tell me, yes, what is TP53? It's a gene. Produces which protein? p53 protein. Okay. Is it tumor suppressor gene, or it's a proto-oncogene? Tumor suppressor gene. Okay, sit down. You tell me how it does its function. I am talking about this. You are okay with that this is a tumor suppressor gene? You are okay with that? So how it suppresses the tumor? You know that? Don't know? Sit down. Anyone? Anyone in this class who knows that? How it suppresses the tumor? The answer is correct. The answer is both A and B. But how? Can you tell me? Yes? How it inhibits the tumor generation? Inhibits mutation. Retains mutation. Retains. একটু সামনে চলে এসো, আমি শুনতে পাচ্ছি না তুমি কি বলতে চাইছো। Detects mutation. Okay. Then what does it do that? Yes? It causes apoptosis. Okay. Fine. Somewhat correct, but not totally. Partially correct. Can anyone help her in completing the mechanism of action of p53 protein? Okay. কে ডিটেক্ট করে ডিএনএ ড্যামেজটাকে? ATM and ATX protein. They whole time scans the genome. Okay. And if there is any mismatch in the genome, any mutation detected in the genome, they immediately informs the p53. How they informs the p53? They starts phosphorylating the p53 protein. Okay. And because of this phosphorylation, actually p53 is attached with MDM2 protein. Okay, all these things were discussed in the Neoplasia chapter. It is normally attached with MDM2 protein, p53, and MDM2 protein causes its degradation. Normally it is being degraded. Okay, but once it is phosphorylated by ATM and ATX protein, when it is phosphorylated? Whenever ATM or ATX protein detects some mutation in the genome. Okay, so immediately it starts phosphorylating the p53 protein, and because of this phosphorylation, the p53 gets separated out from the MDM2. Okay, it gets separated out from the MDM2 and its degradation gets inhibited, resulting in its accumulation in the cell. Clear? Its accumulation. Now, because of this accumulation, immediately it stimulates P21. What is the function of this P21? immediately inhibits the cell cycle, immediately inhibits. So cell cycle has been inhibited. So next, it stimulates DNA repair enzymes. So what this p53 is doing, it is putting a brake on the cell cycle, then stimulating the DNA repair enzymes for what? Why it is stimulating this DNA repair enzyme? To correction of that mutation, for that mutational correction. Okay. So if there are two possibilities. This enzyme will go and correct that mutation. Another possibility, the mutation is so much large or so much in that amount that it can't be corrected by these enzymes. There are two possibilities. If the mutation gets corrected, ATM and ATX will stop their function. They will stop phosphorylating. So p53 will come down to a normal level. Okay, and cell will start its normal activity. If the second possibilities occur, that mutation is of such an extent that it can't be corrected by DNA repair enzymes, then what will happen? ATM and ATX will further phosphorylate and stimulate, means they will try to accumulate p53 protein in increasing concentration inside the cell, resulting in, if too much p53 accumulates in the cell, they will stimulate this gene, Bax gene. What is the function of this Bax gene? Apoptosis. Yes. So if the mutation can't be corrected, the p53 will do the apoptosis of this cell. Okay. So okay, sit down. This is the function of p53 protein. Clear? Can anyone tell me the other name of p53 protein? Guardian of the genome. Yes, very good. It is actually acting as a guardian. Okay. Next, what is the full name of this protein? Okay. What is its function? It's a tumor suppressor gene. How? Can anyone tell me? Oh, you will tell me. Okay. E2F transcription factor ke dhore thake. Yes, very good. Okay. Who phosphorylate the RB protein? Cyclin dependent kinases. You have heard about this? You have heard about the cyclins and cyclin dependent kinases? What are their function? They phosphorylate the RB protein. The RB protein strongly holds this E2F transcription factor strongly, and E2F is, you can think about, it's a key to transition from G1 to S phase. It's a key. Suppose there is a room called as G1 and there is another room called S phase. If a cell wants to go to S phase, he have to release the E2F. It's just a key to S phase. Okay, because the enzymes required for the S phase are being synthesized only if the E2F is available. Okay, and this is strongly holded by RB protein. Okay, clear? Now you can continue. It is phosphorylated by cyclin dependent kinases. Okay, and once phosphorylated, this RB protein releases the E2F and cell can go to S phase. Okay, so this RB protein is actually inhibiting that transition. Clear? Sit down. What about this EGFR? What about EGFR? Yes? Proto-oncogene. It's a proto-oncogene. What is its full form? Epidermal growth factor receptor. Okay. So coming to the next question. Now answer this question. Which of the following is a proto-oncogene? A, B, C, D, E. Which is your answer? What is your answer? A, B, C, D, E. 5 options are there. Yes? A means HER2. Okay. Any other answers? How many of you are agreeing with this answer, A? Okay. How many of you are disagreeing with that? Nobody? HER2 is a proto-oncogene, that's correct. Yes? D, both A and B. Okay. So you are saying that BCL2 is also a proto-oncogene. Okay. You are right. This A and B both are proto-oncogene. What is the mechanism of action of HER2? Can anyone tell me? Stand up and yes? Now, what is the mechanism of action? Means how it is causing cancer. Done. Okay, sit down. Anyone? What is HER2? Growth factor receptor. Very good. So, if it undergoes mutation, what will be the result? The cell will remain in active state without the presence of growth factor. Okay. If it undergoes mutation, it will stimulate the cell for cell proliferation even there is no growth factor. Okay. What will be the result? Cell will proliferate excessively resulting in the neoplasia. This is the actual mechanism, and the most common mutation seen in HER2 is HER2 amplification. Okay. So, normally how many genes do we have of HER2 protein? How many genes do we have? We are supposed to have 2 genes, one from maternal side, one from paternal side. But in HER2 mutation, it has been seen that the malignant cell carries 10, 12 or 20 copies, many copies of HER2 genes. What will be the result of that? What will be the result? If there are 10 copies of HER2 gene, they will produce 10 times more HER2 protein on the cell surface. So, if a growth factor comes and there is a normal cell, malignant cell. Normal cell is having 1 HER2 protein, malignant cell is having 10 HER2 proteins. Who will get the growth advantage? Yes? HER2 mutation containing cell, that means the malignant cell will get the growth advantage. Clear? Clear to all? Okay. Now, answer this question. Which of the following are involved in WNT signaling pathway? Have you heard about WNT signaling pathway? Heard about it? No? Okay. But this was taught in the Neoplasia chapter. What is your answer? Nobody knows about this WNT signaling pathway? Nobody knows that? Oh, so astonishing. Nobody knows that? তুমি বলতে পারবে? What is the answer? Okay, very good. Beta-catenin is a part of WNT signaling pathway. Okay, yes. D, correct. Beta-catenin, APC, E-cadherin, all are involved in the WNT signaling pathway. Okay, sit down. In short, this is the WNT signaling pathway. Okay. Can you explain it by looking at the photo? Can you explain it? You can't. Okay, I am helping you. This is a receptor. Okay, WNT receptor. Fine. And there is no WNT molecules in the resting stage. Clear? In that stage, there is a protein called beta-catenin. Okay? 50% of the beta-catenin is associated with E-cadherin. Okay? What is the function of E-cadherin? Anybody of you have heard previously about it? Yes, it causes cell-to-cell adhesion. Okay? E-cadherin causes cell-to-cell adhesion. 50% of the beta-catenin is associated with E-cadherin. Clear? Rest of the 50% beta-catenin is associated with APC protein and other protein complexes. APC, there is not a single APC protein, there are other proteins too, but APC is the major protein there. Okay? And this forms, beta-catenin forms a complex with APC protein and it causes, this complex is destroyed. Clear? So, in the resting state, what the cell is doing? It is decreasing the cellular concentration of beta-catenin protein. It is associating the beta-catenin with the E-cadherin, rest of the 50% it is degrading. Clear? Clear to all? Clear? Okay, now the WNT molecule comes and it associates with its receptor. Result of this signal is that APC dissociates from that complex. So now the beta-catenin is free, it is not being degraded. Okay, it is not getting degraded. What will it do? It will go to the nucleus and then it will bind to TCF and start cell proliferation. Clear? Up to now it is clear. So, what are the proteins involved in WNT pathway now? First one, beta-catenin. If its concentration rises in the cell, it will lead to cell proliferation. Another protein, APC. What kind of protein is APC? Proto-oncogene or tumor suppressor gene? Yes, it's a tumor suppressor gene because it is degrading the beta-catenin. And what is the E-cadherin? Actually, it is related to cell adhesion, but by indirect way, it is causing tumor suppressor effect. Fine. So, beta-catenin is produced by CTNNB1 gene. Okay? CTNNB1 gene produces the beta-catenin. APC protein is produced by the APC gene and E-cadherin is produced by CDH1 gene. Clear? Clear? Okay. So, this was just revision of the Neoplasia chapter. Clear? Now coming to the today's topic, which is the gastric cancer. So, the carcinoma is the most common stomach cancer, and in the 90% of the patient it is carcinoma. In 10% of the cases there is some other kinds of tumor like neuroendocrine tumor, gastric lymphoma or other tumors, but the 90% of the cases are gastric carcinoma. Okay? And also remember, in 90% of the gastric carcinomas, those cases are sporadic, and in 10% the cases are hereditary or familial. Okay? Means only in 10% of the cases you will get familial history of gastric cancer in first degree or second degree relatives. In 90% of the cases you will not get any kind of such history. Clear? And the gastric cancer is disease of old age. It doesn't involves any child. Incidence is seen after 4th decade, means after 40 years of age. Okay, and men's are more commonly affected than women's. Now, the incidence of gastric cancer in the year 2020 was around 1.1 million. Okay, it's quite a huge number in the whole world, and 7.7 lakhs people died because of gastric cancer. So it's really a very big problem, and in India 60,000 cases were diagnosed in the same year, and 34,000 people died because of gastric cancer. So it's a public health problem. Now, these are the etiological factors of gastric cancer. Okay, what are the etiological factors? Can you read this? H. pylori, Helicobacter pylori. Have you heard about this? Okay, what does this bacteria do? What is its function? Is it good for us or bad for us? Yes? Bad for us. How? Causes peptic ulcer. Very good. How it causes peptic ulcer? It causes peptic ulcer and also causes stomach cancer. Okay, so tell me mechanism of causing peptic ulcer. How it causes peptic ulcer? Anyone? H. pylori causes peptic ulcer, correct? How? Ekটু জোরে বলো. Okay, it affects the antrum part of the stomach. Very good. HCl secretion টা বাড়িয়ে দেয়. How? How it causes the gastrin secretion? ও কি নিজে গ্যাস্ট্রিন সেক্রেশন করে? নিজে তো করবে না। কিভাবে অ্যাসিড সেক্রেশনটা বাড়িয়ে দেয়? কমাবে, মানে অ্যাসিড সেক্রেশনটা কমাবে। তো H+ ওটাই তো অ্যাসিড হলো। Okay, first of all, your friend is totally correct that it involves the gastric antrum. Okay, then first you should know that the pH of the stomach lumen is close to 1, which is quite acidic. Fine, and there is no bacteria which can survive this pH except one. Which one is that? H. pylori. So he has some mechanisms to counter this pH. How it does that? First of all, it clinges with the epithelial cells. Okay, it lies very close to the epithelial cells. It clinges with the epithelial cells. Okay, so the epithelial cells, surface epithelial cells, they don't secrete the acid. Acid is secreted by which cell? Parietal cells, yes, or oxyntic cells. So the epithelial, surface epithelial cells or foveolar epithelial cells, they secrete the mucus. Okay, because acid can also damage those epithelial cells. For their protection, they secrete the mucus and bicarbonate. Okay, so H. pylori clinges with the surface epithelial cells and keep himself close to the epithelial cells so that it doesn't comes in direct contact with the acid. Okay, one defense mechanism is here. Next, it produces a particular enzyme, urease. Okay, because of this enzyme, the urea present in our body, in the blood circulation, that is broken down in ammonium and carbon dioxide. This ammonium the bacteria utilizes for neutralization of that acidity. Okay, clear? So by this way the bacteria survives in our stomach. Clear? Now as this bacteria resides in the antrum, the antral pH is not less, it increases the pH of the antrum. Clear? Because it is releasing the ammonium, so the pH of the antrum is raised. Because of this, the neuroendocrine G cells present in the antrum, they senses that there is less acid in the stomach, okay, and they secretes gastrin. So this leads to the gastrin stimulates the parietal cells and causes excessive acid secretion. Clear? Mechanism is clear? Clear to all? Okay, sit down. Now, this is the mechanism of development of peptic ulcer. If there is more acid, the acid will affect the surface epithelial cell and lead to peptic ulcer generation. Now, what is the mechanism of development of stomach cancer? The mechanism is that after prolonged infection with H. pylori, the body, after secreting high level of acid, body gets exhausted, means parietal cells get exhausted and they start decreasing acid secretion. Okay. So gradually from hyperchlorhydria, the state comes to hypochlorhydria and finally to achlorhydria. Second thing, gastric atrophy occurs, okay, because of this excessive secretions of acid. Fine. Now when this hypo or achlorhydria occurs and gastric atrophy occurs, the bacteria starts colonizing the other parts of the stomach. Clear? Then because of this gastric atrophy, the cell undergoes metaplasia. Then it undergoes, most commonly it undergoes intestinal metaplasia. Fine. Then it undergoes dysplasia. Then from dysplasia, invasive malignancy. This is the way a malignancy develops. Okay. One reason for gastric atrophy is H. pylori infection. Any other reason for gastric atrophy? One reason is H. pylori. Any other reason? Have you heard about autoimmune gastritis? The antibodies are produced against the parietal cells, that can also lead to gastric atrophy, and that again the pathway is same: gastric atrophy, metaplasia, dysplasia, invasive cancer. Fine. So one etiological agent is H. pylori infection. Second one is rubber manufacturing industry, that contains many carcinogens and that causes, it has been seen that the workers working in that factory, they develop gastric cancer early. Tobacco smoking, tobacco contains many carcinogens, it is clear to all, okay. So that also causes stomach cancer. X radiation and gamma radiation. What is X radiation? When a person gets exposed to X radiation. When? Nobody knows that? Yes? When a plain X-ray is done, chest X-ray, abdominal X-ray or X-ray of some other parts of the body, then a person gets exposed to the X-ray. That increases the risk for stomach cancer. Clear? The next is gamma radiation. When a person gets exposed to gamma radiation, gamma rays are produced by which cells? Not which cells, which elements? Radioactive elements. So any radioactive accident or nuclear explosion can lead to gamma radiation. Okay. Do you know about any kind of some explosion? Hiroshima, Nagasaki. The incidence of gastric cancer is too much high in Japan. And can you explain the reason? because gamma, they are too much exposed to the gamma radiation. Yes, smoked fish is also a reason. So these are the etiological agents for gastric cancer. Now coming to the, I have already explained the H. pylori. Okay. Next one, dietary factors are also there. Okay. What are the diet which are harmful for our stomach? First of all, smoked fish is there. Any smoked food is actually harmful for our stomach health. Why? Because when they are cooked by the smoke contains many carcinogens, and when that food is consumed, that goes to our stomach and stimulates the development of cancer. Fine. So these are the food which are actually have been seen to cause gastric cancer. Smoked food. Okay. One is smoked fish. Another example, can anyone give me? Smoked food which most people, I believe that they consume. একটু জোরে বলো। ঠিক আছে না, আমরা এখানে কোনো স্মোকড ফুডটা কনজিউম করি? কাবাব। Yes, it's a kebab. So it is not good for stomach health. Next one, high salt intake. Okay. Pickled raw vegetables. What is pickled raw vegetables? What is that? In plain language, what we call it? Achar. That is also not good for our stomach health. Fine. Next is high intake of carcinogens as nitrates in food and drinking water. Actually the packed food, they contains the preservatives. Packed food I am talking about, and these preservatives, most of them are carcinogenic. Okay, so those are also not good for stomach. And what is good for our stomach health? These are green leafy vegetables. Okay, green leafy vegetables, they provide us iron and they also protect our stomach from cancer. Next is citrus fruit. Any one example of citrus fruit? Patinemu. That patinemu is also a part of the Bengali cuisine, so that is actually good for stomach health. And tobacco consumption, not tobacco, tobacco smoking and consumption of alcohol, those are bad for stomach health. Okay, fine. So these are the food which are bad for our stomach health. Okay, clear? So we should avoid these kind of foods, and these are good for our stomach health. We should consume in more amount this food. Fine. Now already I have discussed this dietary factor. Next, there is some geographical factors, and it has been seen that in the Japan, Italy, Chile, the incidence of gastric cancer is too much. Also there are some racial factors, like in some ethnic groups the gastric cancer incidence is high, like American Indians, they have more incidence of gastric cancer. Similarly, the incidence is higher in black peoples and also in the Chinese in Indonesia. Next one, person having blood group A, they have higher tendency to develop gastric cancer. Okay, so I think at least 5 or 6 people definitely having the blood group A. So I will suggest them to be under checkup. Okay, and avoid those food which I have already discussed, because already you are having increased risk of developing the gastric cancer. And blood group O people, this is the most common blood group. they have more chance to develop the peptic ulcer. Okay. Now, some premalignant changes in the gastric mucosa can also lead to gastric cancer. Okay, like adenomatous polyps, chronic gastric ulcer, these kind of things. Remember, stump carcinoma. What is stump carcinoma? Anyone? কেউ বলতে পারবে? What is stump carcinoma? বলতে পারবে কেউ? Nobody? Actually, if a person undergoes partial gastrectomy, so a small part of the stomach has been kept. Okay, fine. Partially the stomach has been removed. Some part of the stomach has been kept. That is called as stump. And in that part, the development of gastric cancer is more common. Okay, as compared to the whole stomach. That is called as stump carcinoma. Okay, means development of carcinoma in the stump. Fine. So let's come to the pathogenesis. এটা কি বলতে হবে? বলতে হবে কি? Okay. বলো, এটা তোমরা বলো. These are the genes involved in gastric cancer. HER2. You tell me. Yes. তুমি বলো. How this gene causes cancer? Yes. হ্যাঁ, তুমি বলো. এখনই তো এক্সপ্লেন করেছি. শুরুতে এতগুলো কেন এক্সপ্লেন করেছি? তুমি বলবে? ওকে বলেছি. How this HER2 causes stomach cancer? বলতে পারবে? পারবে না. কেউ বলতে পারবে এখানে? কেউ বলতে পারবে না? এখনই তো এক্সপ্লেন করেছি. কি তুমি বলছো? তুমি তো পড়ে এসছো, বাকি তুমি বলো. এখনই তো বলেছি না HER2, এখনই তো এক্সপ্লেন করলাম. ও এখনই ভুলে গেছো? তোমরা কেউ বলো, তুমি বলো. হ্যালো, you tell me mechanism of action of this HER2. তুমি বসো. হ্যালো, you sit down. Mechanism of action of HER2. এখনই তো বললাম না. Just now I have told what kind of mutation is present in this gene. আচ্ছা তুমি বসো, তুমি বলো. Yes. What kind of how this HER2 mutation causes stomach cancer? What is the HER2 gene? Means the protein, HER2 protein, what is its function? Just now I have told that. Just now. ও যে এমসিকিউ ছিল, 3-4টে এমসিকিউ, তাদের মধ্যে HER2 ছিল তো. Just now I explained that. তুমি can you tell, sit down. Can you tell about the HER2? How this HER2 causes stomach cancer? हिंदी में बोलो, हिंदी में, no problem. I can't hear you. थोड़ा जोर से बोलो. You don't know? Okay. You tell. Yes. Okay, fine. Yes, very good. First it activates the RAS protein. RAS protein activates the RAF proteins. RAF activates the MAP kinases. MAP kinases causes the cell proliferation. Fine. What kind of mutation is present in the HER2? No. It's amplification. Right now I told that generally we have 2 genes, but in HER2 mutation, the malignant cells have many copies of HER2 genes. Okay. Just now I explained it. Okay, sit down. So, HER2 amplification can lead to gastric cancer. How it can lead to gastric cancer? I have already explained. Fine. Now, what is this? Yes? Tumi bolo. Yes, you tell me. What is written here? Yes, you tell me. What utter the name? What is written here? You can't see it. What is the name? না যা লেখা আছে সেটাই বলো. CTNNB1. So it's a gene. It produces which protein? Just now I have told in the WNT pathway. Just now I have told. It produces beta-catenin protein. So beta-catenin protein, is it a tumor suppressor gene or proto-oncogene? Proto-oncogene. Very good. So its mutation can lead to gastric cancer. Okay, fine. How it causes? Beta-catenin. This is the WNT pathway. Just look here and tell me how it causes gastric cancer. Okay, sit down. You tell me. It's okay. If there is more amount of beta-catenin protein in the cell, what will it do? It will cause? No. You tell me. Yes. You tell me. Yes, yes. Cano? Just now I explained all the things and you are forgetting. You tell me. Hello. Yes. You tell me. একটু জোরে বলো। আচ্ছা ওই জন্য তো আগে আসতে বলেছিলাম, একটু এই দিকে চলে এসো তো, আমি একবারই শুনতে পাচ্ছি না কি বলছো পিছন থেকে। এইদিকে চলে এসো। অ্যাপোটোসিস ডিক্রিজ করে দেয় কিভাবে? না একবারই রং, 100% রং। তার মানে তুমি ক্লাসটা ঠিকঠাক শোনোনি। সিট ডাউন, সিট ডাউন। তোমরা কেউ বলতে পারো, তুমি বলো। হ্যাঁ তুমি বলো। That is degraded. That is the normal thing. Now once beta-catenin has undergone mutation, so it will not associate with APC protein, so it will accumulate inside the cell. What will it do? Nucleus bind with TCF, causes stimulation or activation of the genes related to the cell proliferation, causes cell proliferation. Fine? Clear? তোমরা একটু পড়ে আসবে। Neoplasia chapter is very important. Okay? Okay, sit down. So this was the mechanism of action of CTNNB1. Now tell me what tumi bolo. Yes, what is written here? Yes, you. Yes, what is written here? Yes, this is name of a gene. What does it produces? Just now I have told that, means 10 minutes back. Yes? Yes, very good. E-cadherin, it produces E-cadherin. What is the function of E-cadherin? Cell adhesion, very, very good. Another function of E-cadherin? Other function? Yes? How? It holds 50% of the beta-catenin. 50% are degraded by APC. Rest of the 50% is holded by E-cadherin. So suppose a person is having CDH1 mutation, what will happen? First of all, the cell will not associate with each other. Okay? They will not form glandular structure. They will be in a dissociated manner, separated. Okay? Because there is no E-cadherin. So the cell will not associate with each other. Fine? Number one thing. Second thing, will it hold the beta-catenin? No, it will not hold the beta-catenin. So what will be the result? Beta-catenin will accumulate, then it will go to the nucleus, then bind with TCF, Stimulate the genes related to cell proliferation, causes cell proliferation. Fine? Clear? Now, sit down, sit down. You tell me, what is the written here? What is written here? Yes. Tumi bolo. Yes. TP53. What does, this is the name of a gene. What is the product of this gene? p53 protein. p53 protein, that is the product of this gene. What is its function? You know that? Don't know? Just now I explained all the things. Other name of p53? Guardian of the genome. Okay? So, it's a tumor suppressor gene. If it undergoes mutation, there will be no break on the cell. If there any kind of mutation occurs, the cell will not stop the proliferation and it will lead to excessive proliferation of the cell with that mutation, and that mutation will carry over. Okay? So, by these 4 genes, these are most commonly associated with, sit down. These 4 genes are most commonly associated with gastric cancer. Clear? Pathogenesis, I have explained all the things. Okay? Now, the most common location of gastric cancer is pyloric antrum. Fine? This is the most common location. Second most common location is the body. Third most common location is the cardia. And fundus is very least common location. Okay? Most common location is pyloric antrum. Fine? Clear? Now, we are going to classify the gastric cancer. There are many classification systems. Okay? First, Borman's classification of stomach cancer. Okay? Borman classified stomach cancer in 4 types. Type 1, type 2, type 3, type 4. Listen it clearly. By attention, listen. Type 1 is polypoid. That means there is a stomach surface. There is a tumor developing and elevated on the stomach surface. That is type 1. Okay? Grossly, I am talking about grossly, not microscopically. If there is a surface, the tumor is developing in this way. Okay? That is polypoid. Type 1. Clear to all? Clear to all? Okay. Next one is fungating. In the fungating, there is elevated margins. Suppose this is a surface, there is a area, in the center there is a depression. In the center there is a depression, but the margins are elevated and elevated above the surface from the, as compared to other part of the gastric mucosa, it is elevated, and at the center it is depressed or there is an ulcer. That is called as fungating, type 2. Okay, clear? Third one is ulcerated. Here, just like the fungating, all the things are same, except that the cells are infiltrating in the surrounding gastric mucosa. Clear? Means, suppose this is a gastric mucosa, the margins are elevated, at the center there is an ulcer, but the cells are infiltrating into the surrounding gastric mucosa. Clear? This is the ulcerated. And type 4, infiltrative. There is no mass, no visible mass, no ulcer in the stomach. Rather, the whole stomach wall has got thickened. Clear? Whole stomach wall has get thickened because of this cancer. Fine? Clear to all? This is type 4, which is infiltrative. Is it clear to every one of you? Who is unclear about these things? Shobai সবাই এটা পরিষ্কারভাবে বুঝে গেছে? ক্লিয়ার টু অল? ওকে, দেন ডু দ্য ক্লাস টেস্ট। এটা বলো কি টাইপের? তুমি আলসারেটিভ, এনিওয়ান? মানে টাইপ 1, টাইপ 2, টাইপ 3, টাইপ 4 এটা বলতে হবে। টাইপ 3, ওকে। এনিওয়ান এলস? টাইপ 3। এনিওয়ান এলস? অন্য কেউ? কি টাইপ 3? You? Type 3, yes, it's a type 3 because there is a ulcer in the center, margins are elevated, and here what is this? The gastric rugal folds are thickened. Why those are thickened? Because cells are infiltrating into them. Clear? এটা বলো কি টাইপের? টাইপ 1, টাইপ 2, টাইপ 3, টাইপ 4 এটা বলতে হবে। টাইপ 2, okay. Why type 2? There is a ulcer, margins are elevated, but there is no infiltration in the surrounding gastric mucosa. Clear? So it's a type 2. এটা বলো কি টাইপের? Yes? Type 1, yes. There is a polypoid growth which is elevated from the surface of the gastric mucosa. It's type 1 in Borman's classification. Okay? Now এটা বলো কি টাইপের? Yes, it's type 4 because there is no polypoidal growth, no ulcer, the stomach wall has got thickened. Fine, it's a type 4. Eta ki type? Type 3 of Borman's classification. Remember, you have to say Borman's classification. Eta ki type? Type 4, yes. Walls are thickened. ঠিক আছে? Clear to all? Now there is another classification system, Lawrence classification system. Fine. This under this classification the tumor has been classified microscopically. Clear? First classification was Borman's classification, that was on the gross picture, gross findings. This is based on the microscopic finding. In this classification, stomach cancer has been divided as intestinal type. Intestinal type means the gastric cancer cells are forming glandular structures. Okay, they are forming glandular structures. In diffuse type, the gastric cancer cells are not forming any kind of glandular structures. Okay, why they were not forming any kind of glandular structures? Why? I have told you about CDH1 mutation. In that case, what happens? There is no E-cadherin. So what will be the result? Cell will be discohesive. That's why this type of cancer develops. Diffuse type means the cellular malignant cell population is totally discohesive. They are not forming any kind of glandular structure. So under the Lawrence classification, there is intestinal type, diffuse type, mixed. Fine. You tell me how the stomach cancer has been classified by Borman's. Fine. Okay. Tell me. Polypoid, fungating, ulcerated, infiltrative. And second classification, Lawrence classification. Okay, intestinal type, diffuse type, mixed. Fine. Okay, sit down. Now just I have 5 minutes, and these are microscopic pictures. This is of intestinal type. You can see the glands are here, and this is the diffuse type. There is no glands are there. The tumor cells are infiltrating diffusely without formation of any glands. Okay. Now this is the WHO classification, the third classification, and this is the most recent classification. I am giving you the 5th edition of WHO classification. Okay. So এটা পরীক্ষার সময় কে বলতে পারবে? কে বলতে পারবে না? ওকে, আমি একটা ট্রিক তোমাকে শিখিয়ে দিচ্ছি, ঠিক আছে, যেটা তুমি পরীক্ষার সময় কিছুটা বলতে পারবে, ঠিক আছে, মানে বেসিক পয়েন্টস গুলো বলতে পারবে, ঠিক আছে। ফার্স্ট অফ অল অ্যাডিনোকার্সিনোমা, ঠিক আছে, ফার্স্ট অফ অল অ্যাডিনোকার্সিনোমা। অ্যাডিনোকার্সিনোমা মানে ক্যান্সারস অফ গ্ল্যান্ডস। সেকেন্ড ওয়ান ইজ স্কোয়ামাস সেল কার্সিনোমা, ঠিক আছে। স্কোয়ামাস সেলের ক্যান্সার। থার্ড ওয়ান ইজ অ্যাডিনোস্কোয়ামাস কার্সিনোমা, ঠিক আছে, ক্লিয়ার। ফোর্থ ওয়ান ইজ গ্যাস্ট্রোব্লাস্টোমা, ঠিক আছে। ফিফথ ওয়ান ইজ নিউরোএন্ডোক্রাইন টিউমার, ওকে। সিক্সথ ওয়ান ইজ নিউরোএন্ডোক্রাইন কার্সিনোমা। এই ছটা বলতে পারবে কেউ? তুমি বলো। ইয়েস, ইউ টেল মি। ইয়েস, জোরে বলো। প্রথমে অ্যাডিনোকার্সিনোমা বলবে, বিকজ দ্যাট ইজ মোর কমন। ইয়েস, অ্যাডিনোস্কোমাস কার্সিনোমা মানে প্রথম দুটোকে কম্বাইন করে দাও, অ্যাডিনোস্কোমাস কার্সিনোমা। থার্ড গ্যাস্ট্রোব্লাস্টোমা, ওটা যদি ভুলে যাও তাহলে অসুবিধা নেই, এই তিনটে তো বলতে পেরেছো। তারপর নিউরোএন্ডোক্রাইন টিউমার, নিউরোএন্ডোক্রাইন কার্সিনোমা, ঠিক আছে। লাস্টে একটা আছে, যদি বলতে পারো খুব ভালো, মিক্সড নিউরোএন্ডোক্রাইন নন নিউরোএন্ডোক্রাইন নিওপ্লাজম। এটাতে কি আছে, যেমন ধরো এই অ্যাডিনোকার্সিনোমা মানে গ্ল্যান্ডুলার সেলের ক্যান্সার, স্কোয়ামাস সেল কার্সিনোমা মানে স্কোয়ামাস সেল যেটা এই যে জায়গাতে পাওয়া যায় স্কোয়ামাস সেল এর ক্যান্সার, ঠিক আছে। অ্যাডিনো স্কোয়ামাস কার্সিনোমা মানে দু রকমই ম্যালিগন্যান্সি দেখা যাচ্ছে, অ্যাডিনো কম্পোনেন্টটাও দেখা যাচ্ছে, স্কোয়ামাস কম্পোনেন্টটাও দেখা যাচ্ছে, ক্লিয়ার। দ্যাট ইজ দ্য অ্যাডিনো স্কোয়ামাস কার্সিনোমা। এখানে হচ্ছে নিউরোএন্ডোক্রাইন টিউমারটাও দেখা যাচ্ছে, অ্যাডিনো কার্সিনোমাটাও দেখা যাচ্ছে, বুঝতে পেরেছো? দ্য ক্লাসিফিকেশন ইজ নট ভেরি মাচ হার্ড, ইট ইজ জাস্ট আ বিট ট্রিকি, ঠিক আছে। তুমি রিপিট করতে পারবে? হ্যালো ইউ, তুমি বলো WHO ক্লাসিফিকেশন অফ স্টমাক ক্যান্সার। ভেরি গুড, ইয়েস, ভেরি গুড, ইয়েস, ওকে। ওটা ভুলে গেলেও কোনো অসুবিধা নেই, বিকজ দ্যাট ইজ আ বিট রিয়ার। নিউরোএন্ডোক্রাইন টিউমার, নিউরোএন্ডোক্রাইন কার্সিনোমা, এই পাঁচটা বলতে পারবে তো? ঠিক আছে, ওকে, ফাইন। I have few more slides, but I think we should stop here because the time is constrained. কত মিনিট আছে? I will continue the rest of the part in the practical class. Okay, fine.